We have an anti-aging protocol which is with us, targeted for general well-being of the patient. The general well-being can be very patient-oriented. Hello everyone, I am Dr. Sahiba Singh. I am the Assistant Director at the Global Institute of Stem Cell Therapy and Research, Chandigarh branch. We are an established institute of regenerative medicine in the region. Aging is a very natural process, as we all know, but when we talk about talking it upon the molecular or the primary levels, aging can be determined by basically the decrease in the innate stem cells. Whenever we are born, whenever we are aging, whenever we are growing, there is a certain curve. First of all, we are kids, then we grow into adults. Then there comes a tipping point when we are not growing anymore, but we start to age. That tipping point is when the number of stem cells in our body are not able to balance out the number of tissue or the cells which are damaged due to daily wear and tear. I'm not talking about only the disease pathologies, the daily wear and tear. For example, when we're eating food, there is certain scaffing of the gut, so that has to be replaced. We lose skin cells every day, and then general process, we lose a certain number of healthy cells which are supposed to be replaced by our already existing stem cells. Once this balance is shifted, that is when the aging starts. So working on that principle, we have an anti-aging protocol which is with us, targeted for general well-being of the patient. The general well-being can be very patient-oriented. For example, if a patient comes to us, I just want to have a more active lifestyle, but I feel I am not that energetic anymore, or I used to be able to have a very good digestive system, and then I used to digest more. Now I'm developing certain preferences according to what I can digest, what I cannot digest. All these things, plus general pains and aches due to the wear and tear and aging of the body, all of these categories which are the main problems of the aging population. Increasing the general pains and aches of a patient, for increasing the metabolism of the patient. If the patient has been an active person throughout their life, so this can actually help them maintain that lifestyle. Or if the patient is right now facing difficulty due to restriction of movement or decreased energy levels, that can also help. If the patient is targeting that I want to have a general well-being in terms of my skin or in terms of what my metabolism is, even that can be helped with stem cells. So in our anti-aging protocol, the stem cells are basically infused via intravenous route. So intravenous, basically we have the infusion done directly into the blood, obviously, and the blood is circulated throughout the body. So in anti-aging, basically we have the autologous stem cell infusion which is done. And these stem cells, once infused into the body via the IV route, are basically circulated throughout the body. So wherever the damaged tissue is, wherever the need for increased metabolism, increased glucose absorption is required, so that is how it functions. So once all the cells are exposed to this immunomodulatory paracrine effects of stem cells, there is an increased glucose absorption in the healthy cells. There is improved general well-being due to decreased amount of damage which is occurring in the day-to-day life. And in case of age-related inflammation which occurs normally, which is the cause of main pains and aches of all the patients, that inflammation level is reduced. So the patient feels more energetic, there are less pain pangs, basically what the patients tell us, and if they want to have a more active lifestyle, they're able to pursue it freely. None of the results in stem cells would be considered quick, because we are not giving a pill or a drug which can have a pharmacological timeline of action, for example 20 to 30 minutes or so. We are basically trying to heal the body from within by improving the already existing metabolism, actually increasing the number of healthy cells which are being damaged, and protecting the healthy cells from further damage. all of these actions can be determined only after completion of our number of sessions which are designated and a recovery period of at least 8 to 9 months. However, the smaller changes such as increased metabolism, more energy, the patient feels more energetic, improved digestion, decreased pain and overall stiffness in the body depending on the cases, this we can see up to 4 weeks after the completion of sessions.